Hi, everybody. Welcome to the Empower Abilities, also known as the Southwest Center for Independent Living, or SCIL for short. We are the same organization. So welcome to the Empower Abilities presentation. And today we're going to share with you on several different programs that we have. Today we have several presenters. We have Chelsea Polonis, who is our Independent Living Specialist Transition Coordinator. We also have Steve Wright, who is our Transitions Manager. And then we have myself, Stacy Amschler, and I'm the Lead Independent Living Specialist at Empower Abilities. We also have Gabrielle Atkins, who is not going to be presenting today, but her information will be shared. The Empower Abilities mission is to promote a barrier-free environment for all individuals with disabilities through public education and advocacy for social change, and to provide a full range of independent living services which will assist in progressing toward his or her goal for independence. Okay. What is independent living? We support individuals with disabilities in their efforts to remain more independent or to regain independence. We encourage people to make their own choices. We help them establish goals of opening doors in the community to encourage a full participation and access for all. We provide advocacy and change policies in government, transportation, employment, and housing, and much more. Some of the services that we provide at Empower Abilities is advocacy, independent living skills, information referral, peer support, transition, youth services, access and technology, home modifications, CDS, and in-home services. And many of these services will be discussed throughout the presentation today. And now I would like to introduce Chelsea Polonis. Or maybe it was Steve, sorry. We're going to introduce Steve Wright.
Hi, my name is Steve. I'm the Transitions Manager at Empower Abilities. I'm going to speak a little bit today about the MFP program, Money Follows the Person. Many of you may be familiar with that, but Money Follows the Person is a Medicaid grant that gets individuals out of nursing homes and helps them to be set back up in the community and gives them funding to be able to do so. Stacy, next. The way the program works is we get a referral, generally generated through a database, an MFP database, but it's set up to work with the Section Q, which is a portion of the minimum data set, the MDS, that you guys do on a quarterly basis, a survey that you guys do for Medicaid. If somebody states that they want to get out of the nursing home during the Section Q portion of the MSD, or MDS, sorry, then you would go into the database and enter that yes in there, and it would generate an options counseling referral to us here at Empower Abilities. And at that point, we would come out and we would talk to the individual and give them options as far as getting out. The Section Q is when you directly enter that in. There's another option as far as options counseling referrals go, and that's a direct referral. And a direct referral is if somebody were to come up to you in the nursing home, one of your residents, and they wanted to get out of the nursing home, you would call us directly, or you would call Gabby Atkins directly. Gabby Atkins is the regional coordinator for the MFP program in District 1. And she works with Division of Health and Senior Services. Her contact information is on the slide there. But if you've got an individual in the facility that you work in, and that individual states that they want to get out, you can call, or as a matter of fact, you can even have them call, or you could call me and have me call. It doesn't matter who calls, as long as that call gets made to Gabby Atkins, and that's what gets the ball rolling for the program, and it will generate that options counseling, and we can get out and we can talk to that individual. Next slide, Stacy. The Section Q, like I said, it's in the MDS system. It's part of the survey. And basically, it's set up so that the residents in a facility have a choice in the matter. It's set up so that the state knows if they want to get out, they have the option of getting out. These people may not be physically able to get out, but that it's up to them. It's their right to be able to state that they want to get out. So whether they can get out or not get out physically, there's services that we can put in place to possibly get around some of their barriers, physical barriers. But if they want to get out, they've got that option to be able to discuss it with somebody and go from there. Whether they actually qualify for the program or not, that's not for us to decide. That's for Gabby Atkins and Division of Health and Senior Services to decide. But basically, it's Section Q. You put that into the MDS database, and we're required, regardless. If you put that yes in there, we have to complete the options counseling. There's no way around it unless the individual has an active discharge plan already in place. That's the only thing that will get out of an options counseling once that referral has been generated. Next slide. This is what you're going to see when you go into the MDS database and enter in that yes or no for the Section Q. I've never seen it personally because I don't go into it for that purpose, but you guys, when you access it through your system during your survey, your MDS survey, this is what you're going to see. And the next couple of slides are going to give you an idea of what you're looking for. Next slide, Stacy. And when an options counseling takes place, what we do is we bring out brochures for all the services that we provide and all the services that are provided for the MFP program. At the same time, we're gathering information as well. Our job is basically to gather the information and find out what the individual is qualified for, get basic information that will help Gabby Atkins, when she does her assessment, be able to determine whether they qualify as well. Some of the qualifications for the program are that they have to be in a facility for 90 days in a Medicaid bed consecutively. If they go into the hospital during that time that they're in the nursing home, then their 90 days would start over after they get released from the hospital and readmitted to the nursing facility. So it's got to be 90 consecutive days in a Medicaid bed. We would come in and we would talk to the client, your patient, do an assessment, a needs assessment, find out what needs they have, find out what supports we would need to put in place before they got out. And many of these supports can be medical, they can be community, they can be social supports, and we establish all these things before they actually get out of the nursing home. We also have paperwork that needs to be done during the options counseling. One is the release of information. We would give that to you as a social worker to get your signature on, as well as the individual to sign as well. There's also paperwork regarding the options counseling that is needed for the MFP purpose. And there's a signature page that we need to get your signature on, just verifying that we were there and completed the options counseling. We'd need to find out whether the individual has had any evictions in the past, whether they have a criminal record. We'd want to gather all the information regarding their history that could be a setback as far as finding them housing. So we'd ask them all these questions. We would consider their needs. That's going to be a big deterrent or a help when trying to find housing. It's not really a deterrent, but it helps us to be able to locate housing. If somebody is in a wheelchair, say for instance, a worst case scenario, somebody needs a higher level of care. They're in a wheelchair, they need completely accessible housing. They can't get around a regular apartment. They need 36-inch doorways. They need a zero entry. Then we know what to look for that client based on the information that we're gathering during the options counseling if they get approved to transition out. So we consider all these things during the options counseling so that we know what we're going to be looking at once we get ready to get them out. And it's also information that Gabby would use, once again, to determine whether they qualify to get out or not. Next slide, please. Medical service needs, we have to have a doctor's approval. Generally, the nursing home, the doctor on staff there at the nursing facility, they have to approve the discharge, or we won't be able to approve their getting out through any of our programs. They have to see the facility doctor prior to being approved, of course, and that's when they get that approval. We would establish a new primary care physician before they got out. That's usually one of the later steps in the program. After they get approved for a transition plan, after they get approved for the MFP program, we start a transition plan. That's 11 pages of pretty much getting all their services in place. We get the doctor's approval there at the facility, and we start looking for a primary care physician to start seeing them once they get out of the nursing home. But we usually wait until the end, once we find housing, to get that set in place because of the fact that we have to establish an appointment within a 2-week period after they discharge from the facility so that they can get their medications renewed and not run out of medications in that process during that time. And we can't really establish a PCP until they've got an address. So housing is usually the longest portion of the program, the longest portion, most time-consuming portion. So towards the end of the transition plan, when we get to the housing portion and it's completed, then we'll set up a PCP. We also establish a pharmacy that they will be using. Usually it's one that has a delivery service because we want their meds to be delivered to them so they don't have to worry about getting transportation or doing without their meds because they can't get to them to be picked up. So it's their choice. They'll establish whatever pharmacy they want, but primarily most of these pharmacies nowadays deliver or have a service to deliver. But usually Walgreens, Walmart, so on and so forth. There's many of them. Family Pharmacy is one of my favorites. They're really good about helping out with our clients. Next slide, please. We also establish whether they need mental health needs or need a mental health care provider. We'll establish whether they've had a provider in the past, whether they're seeing a provider during the time that they're in the nursing home. And if they need one, it's up to them. We can't force them to do this, but if they've had one in the past and they want one, we'll help them get that established so that they could start seeing one once they get out of the nursing facility. Usually there's some clients who are in rehab in the facilities who are there because of alcoholism or drug abuse. And a lot of times the state and even us as well, if they get approved for the program and they're working on getting their transition plan completed, will establish guidelines that they have to complete some kind of treatment before they get released from the nursing home. Next slide. The personal health needs, this here is basically determining what's going to be on their plan of care once they get out for in-home services and also, or either that or CDS services, consumer directed services, for an aide to come in or a nurse to come in and help them throughout the week. We don't get anybody out and just dump them. We set up the needs that they, or the services they have accordingly to their needs. If they need somebody around the house, then we establish that care. And these are the questions that we ask. These are the things that they cover on that care plan. Number one is bathing. We find out whether they need help with bathing. We find out whether they need help with dressing and grooming, toileting, bowel care, bladder care, meal prep, feeding, cleanup, housekeeping, household tasks, and mobility transfer. These are all things that we can get assistance for them for. So just because they may not be able to do some of these things on their own independently in the facility that they're in right now, it doesn't necessarily mean that they won't have assistance with that when they get out and they'll be on their own. They will have care. Next slide, please. This here shows we're going into our DME portion. We establish whatever DME they need. We either get a doctor's order through you guys, through your doctor at the facility, so that we can get that DME upon the date that they discharge. Or if we can't get it approved through Medicaid, then we will get it ourselves. We have a assistive technology department that takes in and refurbishes donated material that we can donate back out to our clients. And that includes hospital beds, it includes wheelchairs, shower benches, transfer benches, any type of durable medical equipment that you could think of. We usually have, but we don't use ours unless, like I said, Medicaid denies the doctor's order. But these are pictures here of some of the things that we do for some of our clients before they get out of the nursing home. We've got a couple here, 2 different clients actually, who transitioned out, but before they transitioned out, we needed accessible housing. One was moving in with his daughter. That's the big ramp that you see there. We built that ramp, Chelsea and I, and our ramp builder, our ramps guy, Eric, that you see in the picture. But in order for him to get out of the nursing home and move in with his daughter, he had to have access to the home. So we created that access with that ramp. The other client there, she looked and looked, and we had been looking for almost a year to find her accessible housing, and it's hard to find. It's that there's a big shortage on accessible housing. So we located an apartment that was available. The landlord agreed to let us put a ramp in, and we put a ramp into that apartment, and she's been there ever since, and she's almost been out a year now. So these are some of the services that we provide that fit hand in hand with our MFP program and our transitions program. Next slide, please. These are some of the things we consider them independent living skills trainings, but these are some of the things that we work on before they get out of the nursing home and once they get out as well. One of those is budgeting. We'll go over the rent, the utilities, the groceries, and establish what those things cost. We'll create a budget for them. It's a mock budget that they can use once they get out. And we also establish your personal care. This we just covered a little bit on. We the personal care is items that aren't necessarily covered by Medicaid and or food stamps for that matter. We get them established on food stamps for the groceries if they qualify for them. If not, we create that, we put the cost in the budget so they can work around that. We get their personal care items priced out, the cleaning supplies we price out, cable and internet if they want it, as well as a cell phone. And once we create that budget, then we establish basically what they can afford for rent, security deposit, and utilities. And then once we budget that in, we don't do anything without their approval. Everything is based on what they want and what they approve of. So if they're okay with the budget we come up with, then that's what we establish. If the rent's too high or something's not right with it, then we scrap that and start from scratch and go from there. Next slide, please. Like I said before, the housing portion is usually the longest part of the whole transition plan. On average, we can generally get somebody out of a nursing home and into their own housing within a 2-month period. That's the average. It's not always a guarantee. It's based on the needs of the individual. If they need accessible housing that has a 0 entry, 36-inch doorways, it could take a little longer sometimes just based on the fact that there's not a lot of it out there. And when people move in, they don't generally move out. So that could be the longest portion of this is dependent on the housing. We give a housing packet. Basically, it's based on the county that the individual wants to move to. And during the time that we're going through the transition plan, they'll be going through that housing packet, looking at the options as far as it's got a list of all the accessible, affordable housing in the county that they're wanting to move to. And we cover 27 counties, and they could move anywhere within those 27 counties. And if they want to move outside of our region, they could move there too, outside of that 27 county region. But we'd have to go through another process of transferring them to another region and go from there. But they're allowed to move anywhere in the state, basically. And we would give a housing packet for any of the 27 counties that we have. And they could actively be looking through that housing packet, looking for their own housing. It's going to have a list of the housing, the price, how many bedrooms, and whether it's tax credit, whether it's income-based of any kind, or whether it's a regular market rate. The more involved the client is with the housing portion, generally the quicker they're going to get out of the nursing home. And the more actively involved in general with any of these processes, the quicker they're usually going to get out of the nursing facility. In the housing, we do a walkthrough. We make sure that it meets the needs of the individual. We make sure it's accessible and affordable, and we make sure it's going to be safe for them. And that's what the housing inspection consists of. Once that's complete, then once the whole housing portion is complete and we've done the walkthrough and we establish that as a good place, we complete the transition plan. Next slide, please. And at that point, we turn the transition plan into the Division of Health and Senior Services to Gabby Atkins and wait for her approval. We do this a week before the actual scheduled transition date, because during that week, Gabby will set up their in-home services or HCBS services, home community-based services. She'll establish their in-home service provider, a date that they're going to start, and have services in place so that when these individuals transition out, they're going to have services set up and they won't be left alone. Next slide, please. Upon the discharge on the day of transition, we generally in the past, before the lockdowns due to COVID, we would go in, we would pack up everything that the client had if they hadn't already packed it. We'd load everything up, we'd haul that for them. We would set up a support system with family or friends for the individual so that they could transport them that day, because we're not allowed to transport the client. We could transport their things, but not them. But we would meet that morning with their support system. We would make sure everything's packed up and loaded up. We would make sure all discharge paperwork is signed and established, and we would make sure that they leave with their medications. At that point, we would leave from the nursing facility. We would go to the apartment manager's office and we would meet there and get the lease signed. We'd go over to the apartment. We'd let the resident view the apartment and we'd get her things or his things put in there. And at that point, we'd call the city utilities department of whatever region, whatever county they're in, and we'd get their utilities turned on. At that point, we would call Social Security and we'd make sure that they are established as their own payee, update their information as far as their address and phone number if necessary, and let Social Security know that they have been discharged from the nursing home. After that, generally, we would have a list that the client would have been working on before transitioning out of all the household items and needs that they would have. They'd have that list established before we'd go, but we'd go shopping at that point. The furniture we'd usually have lined up, ready to be delivered. We'd pay for it that morning and it'd be on its way during the time that we're talking to Social Security department. So once that would get there, we would unload it and get it in the home. And at that point, once that was complete, we'd go do the shopping. And the client is welcome to come with us during the shopping process. But if they're unable to or just choose not to, we would go and we'd do all the shopping for them and bring everything back. We'd unbox or unbag everything. We'd get everything set up in the home for them. And at that point, we would pretty much just call it a day. And this usually takes an entire day, sometimes more than an entire day. Sometimes it goes over 8 hours. But next slide, please. These are some pictures of some of our clients who have transitioned out. This is what the MFP program provides. This is some of the things that we've gotten for our clients. The MFP program consists of a $2,400 grant, which we'll talk more about later, but that is what purchases all the household items that they end up having in their homes. And it purchases pretty much everything that they're going to need, what's deemed as a necessity. Next slide, please. More transition clients. This is one client right here. She gave us permission to take her picture and put her in this slideshow. She is a happy resident. She is a happy client. She's been out for, it'll be a year this month, actually. So she's getting ready to come off of the program, the MFP program. But these two pictures of her, they're of her home, which she is very proud of. Next slide, please. More pictures, more transitions, all different clients. But these are just ideas of what they're walking into when they transition out of a nursing home. They're not going someplace that's just unsatisfactory. They're not going to a dump somewhere. We wouldn't put anybody in an apartment that we wouldn't want to live in ourselves. So they do choose the apartment. They're able to live wherever, but usually the options that they have they're good options. So they pick good places. And we help them get everything set up to where it's nice and homey. And from there, they take over and establish everything as a home, and it looks really good. Next slide, please. More pictures. This is one from a little over a year ago. Both of these have already met their year on the program. And that's one of the aide that you see up top on the left with the client. She is one of our in-home aides, and that is another service that we provide. Whenever we get clients out of the nursing homes, it's up to them who they choose as a provider for in-home services and aides, but a lot of times they'll choose us, and that is one of the options that we give. We're basically a full circle program when it comes to transitions. All the different needs that they're going to have, all the programs that they may need and have as a support, we provide those programs. So none of the people that get out are without the care that they need. And if they don't choose another option, another provider, we provide all those services to them. In the AT department, assistive technology, that was another one. The client that you see up there with the aide, she also received a lift chair through us. So that's one of the things that she can receive, AT. And one of the portions of the MFP program is an additional $5,000 grant on top of the 2,400 that is specifically used for any kind of assistive technology that they may need. So that's always an option too if they have needs in the DME department, durable medical equipment. Next slide, please. More transitions apartments. Next slide. And that's Eric at the top on the left there. That is our ramps guy. And once again, that's another service we provide, is making places accessible that normally aren't. We provide the ramp system, a ramp program. We will build a ramp. On the top right, that is Kip. He's our driver. He's a man of many talents, actually. He does several jobs. He works on refurbishing our AT, our assistive devices, and DME. But he also, on transitions days, drives a truck to get everything delivered to our transitions clients. So he's a lifesaver. And that's me on the bottom helping unload looks like a box springs with Kip for one of our transitions clients. Next slide. On the top left there, that's one of our transitions from a little over a year ago. That's me on the left. That's our client sitting in the red shirt, and that's our program director sitting in between us. She was learning how to do a transition. She was just started here a couple months prior to that. She wanted to learn how to do transitions, and that was her first transition. Then to the right, that is Chelsea and I, as we're unpacking and putting away all the items that a client had just purchased with her grant money on the day of transition. And that's us on the bottom left as well with the same client. Next slide, please. Okay, this is where Chelsea comes in. Chelsea, you want to take over?
Yes, thank you, Steve. All right, so as Steve has gone through the transition process and everything, so once the individual is out of the nursing home and officially back into their apartment, we will be with them for the whole year. So therefore, as you can see on the slide, case management. We will be with them for the entire year, and we do have to conduct 15 home visits. So what we typically do is the first 3 months, we like to go out there twice, just because that's really their settling down period. They're still trying to get adjusted. There may be some kinks that need to be worked out. So we just like to be extra hands-on at the beginning, just so they're still getting their feet under them from being out, because that is a big adjustment and it's a big transition. And then after that, for the remaining 9 months, we'll just visit once a month. But just because we're visiting once a month doesn't mean we're just going incognito. We are still there for them if they need anything, but we do like to encourage as much independence as possible. So we kind of say it as if our phones aren't ringing, that's a good thing. But if they do ring, of course, that is fine. We're there to help them. So that's what kind of goes in the visits. And then also for funding, like Steve has already mentioned, it is a $2,400 grant. So because it's $2,400, we do not have to spend it right then and there on the first day. Sometimes we do spend it all on the first day, and then they don't have anything left for the rest of the year, and then they're gonna have to take on and pay for things themselves with their own funding. But if not, if we don't use the whole $2,400 on that first day when we transition them out, then that means they have the rest of the year to use that money. So any necessities that they need throughout the year, and if they have funding left over, they can contact us, let us know what they need, and then we can go purchase that for them and drop it off to them. But a thing that I would want to mention within the $2,400 is we do have a $150 limit with food. And the catch about the food is we have to spend that $150 within the first month. And then after that month, whatever is left of the $150, it just goes back in the $2,400 or whatever's remaining to buy the necessity items. And so we do like to stock them up for the entire month. And as you can tell, the $150, we do like to plan that to last them the entire month, because when individuals get out of nursing homes and we call the Social Security office, like Steve mentioned before, it does take a little bit for their fundings to get back to them and to get in the mail. So we like to make sure that they're all stocked up for the month until their checks get back into their name. And as you can see on the screen, under case management, we do have MFP compared to non-MFP. So for the non-MFP, that's really when an individual isn't approved for the Medicaid funded program. For whatever reason may be, I don't have any great examples off the top of my head, but if they aren't approved, but if there's nothing really like critical or anything, if there was just something they weren't approved on that we don't feel is legit or anything, we can get them transitioned out through our own agency and through our own funding. But granted, with that, it's not the $2,400. We typically go between $1,500 to $2,000, depending on the client and the needs and everything. But with non-MFP, so for the case management, we just kind of do as needed. So at the beginning, we'll visit them two times the first 3 months, and then after that, it's just kind of as needed. It's not a huge requirement by the state as MFP is, but we really do like to stay involved and stuff. But with non-MFP, it is just a little more lenient and stuff, because our whole philosophy and stuff is encouraging independence and everything, and so we just like to kind of let them do their thing. But again, like I said, we're here if they do need anything. Okay, next slide, Stacy. All right, and then closing out. So hopefully our clients make their 1 years, and we've had a lot of success, but some people, they do go back to the nursing homes or other things happen, but we don't consider that a failure ever. If an individual is out for a month because they knew they could do it and they genuinely tried, but something happens with their health and they have to go back in, hey, that was a success for them. They tried the best they could, but unfortunately from there, we will close them out if they do have to return back to the nursing home. But if they don't and they make their whole year, then we will close them out. By then we should have a total of 15 visits, if not more. Sometimes people need more. But from there, we basically go to the MFP database again. And at the bottom of their page, we'll just put in a little piece of information saying they've completed their 365 days. And we'll kind of put a little description, and then their case will be closed. But their case for our agency, so when we open clients, they go from a casual consumer to an intake consumer. That way we're actively involved with them, and we're helping their cases as much as possible. But when that 1 year is completed, then they go from intake back to casual. And that doesn't mean like we're dropping them and they're basically going to start over where they're out on their own. That just means we're not as involved, but we are still there as an agency to help them, to assist them, to send referrals, whatever they may need. It is just, we're just not actually going to be as involved, but we're still there for them if they ever need anything. And then for non-MFP, kind of like what I was mentioning in the last slide, it's kind of a consumer's independence. It's just on the basis and everything. Some people may need so many visits and some don't. So with that, depending on where they're at, they don't necessarily have to go the entire year. Say they've been out for 6 months, and if I'm really haven't really been like, communicating with them as much, or they're not really expressing, oh, I still need all this guidance or help, then I will converse with them and see, hey, like, do you feel comfortable or with everything that you've accomplished this far? If you're okay with it, we can go ahead and close out your case. But if they have more goals that they would like to establish and achieve for, and like we can assist them with that, then we will keep them open. But the max is 1 year. And so for like non-MFP consumers, just like MFP, they will just be taken from intake to casual. And again, casual doesn't mean we're going to be dropping anyone off. We are always here. Our doors are open, and Steve's number is always available. So yeah, so if there's ever anything, we're always here to help, regardless if an individual is closed out or not. Okay, and so next, I believe after closing all that out, our leading independent specialist, Stacy, will be taking over and talking about Medicare and claims and how she can help you with that.
Thank you, Chelsea. Before I get started on that, I did want to mention that when individuals get out, or even before they get out, we have various programs and events that people can be involved in, groups, social groups, and educational groups both. Right now during COVID, we are offering them all virtually at this point, but eventually we hope to get back to getting out in the community and just having a great time together and supporting one another through peer mentoring. Like Chelsea said, I wanted to share on one last program that we do have as part of the center. I am a certified claim counselor, and CLAIM is the Community Leaders Assisting the Insured of Missouri. And we are part of the Missouri SHIP program, the State Health Insurance Assistance Program. It's a nationwide network, and we work to meet the local needs of Medicare beneficiaries population. Some of the things that we can do as a counselor is we can help with Medicare enrollment and billing. We can help with Medicare Advantage plans, supplement insurance plans, Medigap plans, Medicare prescription drug program. We also look at long-term care insurance policies, public benefits, Medicaid, food stamps, all of those kinds of things. We help with appeals and grievances. We can also help with suspected waste, fraud, and abuse and report that. All the services that we provide to our beneficiaries are free. I just kind of want to go over some of the programs that I do help with as part of being a claim counselor. The Extra Help through Social Security is a really big program that we really try to make sure that our Medicare beneficiaries are aware of. And it is income-based, and this does change annually. Beneficiaries may get an application in the mail through Social Security because they meet certain criteria. They can give me a call. They can give CLAIM, the general number, a call as well for assistance in completing this, because it can also be done online. And this helps with Part D premiums, deductibles, copays, and eliminates the coverage gap. Another program that is available is the QMB program. This is a really awesome program, but it is income-based. The individual has to have Part A and Part B to qualify for this. They still pay a Part B premium. But when you have QMB, this can help with some of those expenses and cover that coverage gap that they may have. You have to be enrolled in Part A. The income limit, as you can see there, is between $12,000 and $12,000 for a single person annually. And like I said, these change every year. So you need to check back and see if they've increased or decreased. They may automatically be enrolled in the Extra Help for Part D that we just discussed. Another program is SLIMB, or the Specified Low Income Medicare Beneficiary Plan. This pays for only your Part B premium. And this may assist somebody that is not able to pay the $144 a month Part B premium, but they can pay for everything else. This does not give them Medicaid benefits, but Medicaid will cover that premium for them. Again, there's some income limits there. They are also automatically enrolled in extra help for Part D that we explained in a couple slides ago. And the last program that I wanted to discuss is the QI1, which is also called Slim B2. It just depends where you're at and what they call it. But for this, it only covers Part B premiums as well. And this is a higher income bracket, but they are also automatically enrolled in Part D extra help. And just to kind of cover some basics on Medicare, conditional Part A is possible for those that may or may not have worked 10 years or had 40 credits to qualify. So retirees 65, and if they're low income and do not have 40 credits, or they didn't work 10 years, or maybe they were a teacher and they didn't pay into Social Security, they would not qualify for free premium free Part A. So they would have to apply for the conditional Part A. And they have to apply for this at the Social Security office, and there's a certain date for that each year. They have to get a printout as documentation that this was done. This is very important because we've had issues where they weren't enrolled or they were enrolled. So if they have a printout of this documentation, it really helps to get that out of the way. Then once that is done, they can apply for the QMB program with the state, the Medicaid office. And so this is kind of a catch-22. You have to have one or the other to qualify for the other. So it's important to apply for the conditional Part A, have the printout, and then apply for the QMB so that they know that that's supposed to start. This can affect missionaries, school teachers, homemakers, and so on. Another program that I tirelessly work with the MFP program as well is the 63 and over waiver. This allows individuals that are 63 and over that need nursing home skilled care or in-home help to qualify based on their age, not necessarily their income. There is some income guidelines on that, but it is pretty manageable. And this allows individuals to qualify for Medicaid to receive their services and get their in-home help. Sometimes we'll have to do division of assets if they're a married couple and the income puts them over the limit for Medicaid or the 63 and over waiver. We can do a division of assets so that the total income does not count against them. Okay. We also help with spend down and non-spend down issues, and then the extra help programs as I discussed. Division of assets, I mentioned that in previous slide, but this provides a way for a married couple to set aside income when one needs care in the home or HCBS. And they have to be in Missouri. You have to complete forms, and they have to be in the hospital for 30 days or in a certified Medicaid bed, which if they're moving out of a nursing facility, this qualifies them for that. Their combined assets have to be disclosed on the forms. And then what it does is it takes the spouse's income and basically shelters it so that the couple can still have their total income to live at home, but it doesn't count against a spouse that needs the care. And they are taken care of under Medicaid. Okay. To reach Missouri Claim, you can call the 1-800 number on your screen, or you can go to the website, or you can call me at Empower Abilities as well. Okay. If you have any questions, feel free to contact any of us once you finish viewing these slides. And feel free to go back and watch the slides at any time. And we are here to help you in any way that we can. And now on the slide, I have all of the different emails and contact information on there. So if you have any questions, just feel free to call us at 417-886-1188. And I want to invite the other presenters to come back. Chelsea and Steve.
Yes, thank you.
So thank you for joining us today. If I can get Steve back on here. All right. Here we